Vitamin D is a group of fat-soluble corticosteroids responsible for increasing intestinal absorption of calcium, magnesium, and phosphate, and multiple other biological effects. In humans, the most important compounds in this group are vitamin D3, also known as cholecalciferol, and vitamin D2, ergocalciferol. Cholecalciferol and ergocalciferol can be ingested from the diet and from supplements. Only a few foods contain vitamin D. The major natural source of the vitamin is synthesis of cholecalciferol in the skin from cholesterol through a chemical reaction that is dependent on sun exposure, specifically UVB radiation. Dietary recommendations typically assume that all of a person's vitamin D is taken by mouth, as sun exposure in the population is variable and recommendations about the amount of sun exposure that is safe are uncertain in view of the skin cancer risk. Vitamin D has a significant role in calcium homeostasis and metabolism. Its discovery was due to effort to find the dietary substance lacking in children with rickets, the childhood form of osteomalacia. The two major forms are vitamin D2 or ergocalciferol, and vitamin D3 or cholecalciferol. Vitamin D without a subscript refers to either D2 or D3 or both. These are known collectively as calciferol. Vitamin D2 was chemically characterized in 1931 and in 1935, the chemical structure of vitamin D3 was established. Vitamin D deficiency has become a worldwide problem in the elderly and remains common in children and adults. Deficiency results in impaired bone mineralization and bone damage, which leads to bone softening diseases. Being deficient in vitamin D can cause intestinal absorption of dietary calcium to fall to 15%. When not deficient, an individual usually absorbs between 60 to 80%. Vitamin D supplements have been widely marketed for their claimed anti-cancer properties. Associations have been shown in observational studies between low vitamin D levels and the risk of development of certain cancers. In general, vitamin D functions to activate the innate and dampen the adaptive immune systems. Deficiency has been linked to increased risk or severity of viral infections, including HIV. Low levels of vitamin D appear to be a risk factor for tuberculosis, and historically it was used as a treatment. Supplementation slightly decreases the risk of respiratory tract infections and the exacerbation of asthma. Evidence is lacking on whether it does so in children under 5 years of age. No clinical trials have been done to assess its effect on preventing other infections, such as malaria. Low levels of vitamin D are associated with two major forms of human inflammatory bowel disease, IBD, Crohn's disease, and ulcerative colitis. A systematic review of clinical studies found an association between low vitamin D levels with cognitive impairment and a higher risk of developing Alzheimer's disease. Both vitamin D components have proved very important to our health. If you are concerned your vitamin D is low, check out the special offer below in the link. Please subscribe to our channel for more vitamins explained. Thank you.